So when you have lower back pain, depending on what it is, will depend on what actual treatment we will do and how we will do it. But here are a few of the treatments that we found effective for lower back pain. I'll show them to you and actually share which ones are helpful for which kind of conditions. Spinal adjustment manipulation, you're going to lay it on your stomach face down. This is good to help, one, reduce general pain to the lower back pain. It helps reset the nervous system and kind of reset the system down there to reduce pain, so then we can go do some exercises and get some movement in there. Increases mobility to the lower back. It can help reduce some of the muscles, reduce some pressure there. So good for joint irritation, SI joint, some disc irritation as well. This would be. Sometimes we may use a drop piece like this, where a table will pop up, down. You're gonna lay on your left side, face the door. Face me. So that's what they're on. In your stomach. A lot of times with back pain, you have some muscle tightness. So we like to use this hypervolt to help loosen these up as well and reduce the pain. We do the lower back, giving up to the upper back. Also into the hip when that's needed. The hypervolt works really well. We will also do some soft tissue work with some scraping tools. We have this nice T-tool to help apply pressure and lightly massage the muscles, or the beveled edge, and scrape to increase some blood flow to the area. Blood flow can help loosen things up a little bit more. And reduce tension to the fascia and muscle. Another treatment that we do that is very helpful for lower back conditions like strained lower back, just general lower back pain, facet syndrome, to help loosen up and decrease the sensitivity, would be some dry needling. These would be just really small needles, same needles as acupuncture, but it's not acupuncture. This is more so to help get into the muscle, more than what scraping can do and cupping can do. This will get into the muscle itself and promote a pro-inflammatory response to increase the blood flow to the area, loosen it more, and also reduce the tension in the fascia. The fascia is a big part of what this helps with. Fascia is a connective tissue that connects the whole body together from one muscle to the next, and it's very helpful to make sure those are moving well and can flow well. Here's just a few dry needles in Aaron's back. We'll also put one out towards the hip, a couple into the hip. The hip plays a big part into the lower back, and that's function and recovery. So there's just a few. If we need to, we may put some electrodes through the needles to help us move a little bit faster and loosen the muscles up more and just have a better result. There's a better effect. And when you feel this, Aaron, feel that?
Like a twitching type?
Maybe like a pulse.
Yeah, a little bit.
Okay. Is it comfortable?
It is.
Okay, we'll just leave it there. We'll let that sit for 10 to 15 minutes, and then we'll come back and reassess and see what's improved. So there are a few treatment methods that we do to help you with your lower back pain to address several different parts of what could be causing it. Joints, discs, muscles, fascia, different joints, ligaments, and trying to affect it that way. Whatever you need, whatever mechanism, whatever condition you have or diagnostics we have, whatever is causing the pain, we'll depict on what's treatment we do. The other thing we do is treat you, reassess to see how it's improving. We should see some improvement shortly after if it's going to work. If it's not, then we'll change courses on what actual treatment needs to be done. From that is the best way to help treat you and help get a good treatment plan to help you get back to the activities that you love and enjoy life as you do.